But what this does with respect to putting fluoride in the water supply is it basically doesn't allow that anymore in the state of Florida. It's forced medication when they're jamming fluoride into your water supply. And they did it because, if you have fluoride, it'll help with dental. And I'm not saying that's not true, but we have other ways where people can get access to fluoride. When you do this in the water supply, you're taking away a choice of someone who may not want to have overexposure to fluoride. And there have been studies done, and Joe will talk about it when he comes up, that there are impacts to pregnant women, to children, about having too much of this. And you don't even have to agree with that analysis, but at the end of the day, we should all agree that we want people to be able to make informed consent, have informed consent when it comes to these things. Jamming fluoride in the water supply, irrespective of whatever for the teeth, when you can get that other ways, that's impinging on other people's ability, to have access to water in ways that they may not want to be exposed to what is essentially a forced medication. So the legislature was able to pass that, and we will be able to sign that. Joe Ladapo issued guidance, I guess like last year, right, late last year, about community water fluoridation due to the potential risks that were associated with exposure. And again, pregnant women and children were at most risk. That this fluoride is a naturally occurring mineral present in groundwater, fresh and saltwater, rainwater, soil, plants, and foods, but the community fluoridation adjusts the amount of fluoride in drinking water to levels that are recommended high enough so that it could deal with the tooth decay. But of course, you can get fluoride in toothpaste other ways outside of that. So what you've seen is these studies have been coming out. People are now looking more critically at this. And honestly, I think because we saw how out of whack some of these medical elites were during COVID, I think people are just much more skeptical when these elites are trying to jam anything down our throats. And so there's a lot of people that look at this and they say, okay, well, show me the evidence. The burden is on you to prove why this is a net benefit, which I think Joe would argue it's probably not in terms of health. But the highest burden is, why should this be forced on people? And it really shouldn't be forced on people. So you're seeing more and more places. You have countries where a lot of the municipalities in Europe have moved away from the forced fluoridation. Many municipalities in the United States, and a lot in Florida. I mean, we've had a number of counties that acted after Joe's guidance, but also other stuff that was happening there. So this is, I think, the things that a lot of people want to see done. They want to see protections against this. They understand there's other ways that you can get fluoride. If